So we're looking at what is known as uterine atony. So uterine atony is a word that we have caught so many times, right, along this channel, right? So it's a birth complication. So this is when your uterus is supposed to contract after you give birth. Now that contraction helps a lot of things. It helps, most importantly, it helps like stop bleeding that should occur after childbirth, you understand? So but if your uterus is failing to contract, if the uterus is failing to contract after childbirth, you have these issues like that, all right? So that's what is called a uterus atony. Okay, so it's a serious condition. It occurs when the uterus fails to contract effectively after childbirth. So it's usually lack of muscle tone, all right? So it prevents the uterus from clamping down on blood vessels. So this leads to a lot of bleeding after childbirth, all right? So that's the most common cause of women dying from childbirth worldwide. So what happens in uterine atony is after delivery, the uterus should contract to stop bleeding from the placental blood vessels. So in uterine atony, it still remains soft. Okay, the myometrium still remains soft, so blood is still flowing freely. Okay, then it can occur after vaginal birth, all right, after cesarean sections or miscarriage or uterine surgeries. Okay, so risk factors on the mother side, pregnancy related. Okay, risk factors like what would predispose, what would make it possible for a woman to actually have these issues. If her age is above 35, if she's obese, if she has uterine fibroids, pregnancy related, labor related, medication related, then if she has history of previously having this postpartum hemorrhage. Okay, so symptoms is heavy vaginal bleeding, okay, soft enlarged uterus, low blood pressure, rapid heart rates, the person is dizzy, the person can faint, the skin is pale. This is because you have lost a lot of blood, inability to urinate, or severe back pain. So diagnosis are just those physical examination, checking for vital signs, checking for ultrasound, blood test. So treatment, you just give some drugs that can help to it's just drugs that will help to contract the uterus. Okay, tamponade techniques, surgeries, okay, supportive care.